I'd like you to kind of keep this image in mind while we go forward in our discussion, because we'll come back to it. Hang on a second here. Let's see if we can get this to advance. Nope, not working. There we go. I am actually a veterinarian and actually board certified veterinary behavior specialist. So the best way I can describe that to you is the human equivalent of being a psychiatrist. So I have advanced training as a veterinarian, like your general practitioners do, who I'm sure do your wellness exams and your shelter veterinarians. But then I went on to do advanced training. There's 4 years of advanced training in psychopharmacology, in ethology and behavior, in behavior modification, and additional areas such as internal medicine, neurology, and that kind of thing, in order to be able to have focused knowledge specifically on behavior. The behavior specialty is considered a general specialty in the sense that we're expected to have knowledge of all kinds of animal behavior, everything from domestics to wildlife to zoo animals. But there's no doubt that the bulk of our practice is dogs and cats in a clinical situation. Frankly, primarily dogs. About 70, 80% are dog clients. Another 10% are cats. And then the other 10% is things like horses, bunnies, that kind of thing. And this is just a representative sample of some of the various patients that I have seen in the past year or two in the actual clinical practice. So today what we're going to be focusing our discussion on is noise aversion, basically noise phobias. And storms and fireworks are certainly the most common complaint brought forward, but in the busy urban environment that I'm now finding myself in, noise phobias of a variety of different sounds can be an issue or a problem. So we'll talk about that a little bit more. So in this talk, what we're going to try and do is just go over some of the basic information associated with noise aversion, looking at things like diagnosis and how we determine whether or not the animal actually has a noise sensitivity or phobia, what animals are most likely to have issues with noise sensitivity, and what that actually looks like in a dog or even a cat. What is it was an animal that has a noise aversion? What symptoms do they show? Are there any underlying causes? In other words, are there certain things that predispose an animal to developing this problem? And how you can figure that out when you're talking to your clients or your customers. How can you best help them figure out if that might be an issue or problem? What the prognosis might be like? Will they recover? Can you fix it? What kind of things get in the way of our customers and clients seeking help for the animals? And if they do seek help, what can we do for them? What can we offer them that might mitigate or improve the situation and the quality of life for them and for their pets? Is there any way to prevent it? Certainly, we've learned a lot about socialization in kittens and puppies. Is there something that we could do during that period of time that might make it less probable that they have this problem as an adult? And last but not least, I'm going to walk you through a case example and give you some resources that you can access to help animals under your care and customers and clients that seek help from your organizations. So first off, a definition. What is noise aversion or sensitivity? Basically, these are animals that are showing signs of fear, distress, anxiety, even irritation and anger provoked by certain sounds. And they may show some pretty significant physiological symptoms like high heart rate, trembling, muscle tension, drooling, panting, sweating. So clear signs of distress, physiological distress associated with that exposure. In this definition, let me point you back especially to that irritation and anger part, because in cats, at least, it's not uncommon for a cat that has a noise aversion or sensitivity to show increased arousal and or redirected aggression. And some of you may have encountered this. The client or your customer may present a cat that has shown aggression towards people, but it's in very specific situations, such as when the owner drops a baking pan, for example, and the cat tackles the owner and bites them. That animal, that cat, most likely has a noise sensitivity or noise aversion. So just to give you some examples. A noise phobia is when the reaction to that noise is so intense and so out of proportion that it's impacting the animal's quality of life. They can't function anymore. And so what I see again in our busy urban environment is dogs that won't go outside to eliminate, because they're so worried about the sounds outside their home. They will not go outside. They won't go for walks. I mean, what dog, when you pick up the leash, should say, hey, let's go for a walk? Doesn't, go ahead. Those are often dogs that have noise phobias. So that's unfortunately something that we see not infrequently in the suburban and urban environments. So is this a frequent problem? Oh, yeah, it most certainly is. When you look at the various research papers out there, the numbers in those papers vary from about 13 to 30%, give or take, which paper you look at in terms of overall prevalence of this problem. But some estimates are actually as high as 40%. We figure that a lot of these are underreported. In other words, that the customers or clients aren't aware that the dog is truly having an issue or suffering. And consequently, they just, when you ask them, does your dog have a problem? They say, oh no, they're fine, which I'll just let you know in advance is my personal peeve and my most hated word in the English language is when people tell me that the animals are fine, because so frequently they miss the boat and just are not aware that their animals are struggling. So are only dogs affected? Absolutely not. I alluded to the fact that this can also be a problem in cats, and in fact, it's a fairly frequent problem. The reason why cats aren't more on our radar is because most often cats that are afraid hide. And so the owners are unaware that the animal is having a problem or is struggling. Where they come into my facility or my clinic is those animals that show redirected aggression, which I mentioned to you, where a loud noise occurs and the cat strikes out at whatever the nearest target might be, often another cat or an owner. And that is the reason why they are then brought in, is because of the aggression, but the underlying cause for the aggression is that noise phobia. And more than cats and dogs can be affected. It's actually a frequent problem in horses. Diana was mentioning to me that a number of you are from rural shelters or rural organizations, and consequently have to deal with horses and livestock and other animals. And recent research indicates that fairly large percentage of horses, about 22% in that one study that I cited, have some form of noise sensitivity or phobia. And an earlier study showed an even higher number than that. That's 79% of the horses have some level of noise sensitivity or phobia. That's a whopping number. And any of us who are horse owners or have been horse owners know that many of them are quite sensitive to sound. I don't know how many of you had a chance to watch the Olympics or any of the equine events, but the cross-country course for horses allow the audience to be very close in and very tight in the course that the horses had to navigate. many of those horses you may not have noticed if you're not a horse person, but I bet you the horse people noticed were wearing bonnets. And what they have in the bonnets are stoppers, earplugs to help mask sounds for the horses to reduce their stress level and allow them to better able focus and compete. So horses can be affected as well. So what are some of the characteristics of this problem? Well, the most common noises, the classic ones that people present animals for or notice it being a problem are going to be thunderstorms and fireworks. When they've done surveys, additional noises that stick out are engine noises like cars, buses, garbage trucks, that kind of thing. Just loud voices like people shouting or yelling. I have a lot of sports clients, or clients who enjoy sports, I should say, who note that their dogs get really upset when they get excited about a sports game and start yelling. Vacuum cleaners are a common one as well. And for those of you who are in rural areas, or for those of you like myself that live in Loudoun County, gunshots also can be a major source of fear and anxiety in dogs. Herding breeds, hounds and toy breeds seem to be most commonly affected. So because we know that certain breeds are more likely to have this problem, our suspicion is that genetics plays a significant role in this disorder. We don't have a lot of targeted studies on that yet, but pretty willing to bet good money that genetics plays a significant role. Typically, the dogs that have issues are somewhere between about 1 year and 5 years of age. And there is the thought that if for some reason these dogs are not exposed to sounds and noises at a young age, they might be more at risk. So for example, dogs that are raised in a rural environment that are then brought into an urban environment might really struggle and develop noise sensitivity. And we see that a lot in the hounds that are brought up from the South and adopted into our environment here in the Northern Virginia area. Many of them have sound sensitivity, which you would never think of in a hound breed, right? Because you'd think that they would have been selected to tolerate gunshots, and so they shouldn't have sensitivity or phobia to other sounds, but they do, they develop them. No sex predisposition, so it doesn't matter if you have a boy dog or a girl dog, that doesn't seem to make any difference. And alas, we do see a higher incidence of this in dogs adopted from shelters and rescues. The million-dollar question is it the chicken or the egg? In other words, does the shelter or rescue experience somehow affect these dogs in such a way they are more likely to develop noise phobias, or do they end up at the shelter or the rescue because they have a noise phobia and people don't know how to deal with it or handle it? We just don't know. The exception to the rule is the older dog. Remember, we said that the most common age range was about between 1 and 5 years of age. When you get an older dog, meaning a dog over 5 years of age, that all of a sudden develops a noise sensitivity or a phobia and gets rapidly worse over time, almost always those dogs have some kind of underlying undiagnosed pain issue, most commonly musculoskeletal pain, which when it's identified and appropriately treated, usually leads to great improvement in that noise sensitivity or phobia, and in some cases, complete resolution. So when the pain is addressed, the noise sensitivity or phobia resolves. So very important to make sure that there's no underlying medical conditions that are contributing to the dog's sensitivity and discomfort. And this is just a close-up of the paper or the research that evaluated that issue, wherein noise sensitivity in older dogs seemed to be linked or was linked with musculoskeletal pain, so arthritis and the like. So how does noise phobia occur? Well, I mean, loud noises are potentially dangerous, right? So it's a protective mechanism. The dog wants to flee or run away from loud noises. I also often wonder about their sensitive hearing. They're designed to be in a more rural environment to pick up the sound of prey and the like, and now we're dumping them into these noisy homes. The noises that seem to really be most likely to trigger sensitivity or phobia are loud noises that occur with periods of silence in between them. So not a continuous roaring type of sound, but something like a beep, for example, an electronic beep. That can be a real, something that can really trigger acute anxiety in these animals. Or something that turns on, shuts on and shuts off. So think about an HVAC system or a water softener or a dishwasher. Those are all appliances that dogs can often develop noise sensitivities or phobias about. They become sensitized over time from repeated exposure and repeated stress. And in some situations, again, remember that genetic predisposition that we mentioned, the fears and phobias can be seen as early as 9 weeks of age. So in the puppies, and again, possible genetic, and important to remember that if it's not addressed, they will get worse over time. So they become sensitized over time from repeated exposures. The older they are, the more times they're being exposed. Think about storms. And they will get worse over time unless there's an intervention and they are treated. Pretty classically, clients will come to me with dogs somewhere around about 3 years of age. They'll tell me that the dog was fine. There's that hated word, was fine as a young dog. Then they had some bad storms, when the dog was maybe 1 year or 2 years of age. Dog seemed to handle it. They could tell I wasn't doing that great, but recovered, wasn't a big deal. And then by the next year, when the next set of storms, the dog is trying to dig his way to China underneath the bed because it's so frantic and scared. So that's usually how the evolution occurs, is that repeated exposure, they become more and more sensitized and they become more and more worried. So what are the main causes? Well, certainly a sudden traumatic event, people doing really silly things like taking their dogs to a 4th of July parade and somebody setting off fireworks behind them and they get really super scared. And at that point, now they are sensitized and subsequent sounds make them more and more worried. We already talked about the repeated exposure to those sounds and the long-term stress. There's some question about whether or not dogs can learn to be fearful from other dogs. And that is certainly discussed. It is certainly suspected, but it's not been proven. There's no research that indicates that happens. In other words, if my one dog has a fear of storms, will she give that fear of storms to my other dog? As far as we know, that doesn't happen. What about inappropriate owner response? Yeah, you can make it better and yeah, you can make it worse. So if every time the smoke detector goes off, for example, everybody jumps up, runs around frantically, gets worried, gets upset, that is not going to help the situation at all. And in some situations, the owner or the client's behavior can signal to the dog that bad stuff's about to happen. So we do want to address our own responses, our clients' responses, and make sure that we do everything we can to minimize the dog's or cat's anxiety. And we'll talk about that a little bit more. Frankly, the cause is often never identified. We have no reason we don't know of any reason why the dog becomes this way. And again, I refer you back to the fact that we're pretty sure that there's a strong genetic basis to this. So some questions to ask your clients, your customers, if you're trying to help them out and figure out if this is really an issue or problem. What does the animal do when it hears, remember those common things, thunder, wind, rain, fireworks, gunshots, loud voices, any kind of sudden intermittent noise, especially electrical noises like cell phone pings, the dropped out items, remember the dropped cake pan with the cat, mechanical engine sounds like cars and trucks and dumpsters, garbage trucks, ambulances and other kinds of emergency vehicles. Vacuum cleaner is universally hated by most dogs, but some of them are definitely afraid of it. And then electronic noises like the HVAC, washing machine, dryers, microwaves, water softeners, that kind of thing can be problematic. Has the dog's response changed over time? As I said, this is kind of a leading question in the sense that you're trying to get an idea if it's generalizing and getting worse, and most of them will be getting worse over time. When the owners tell you that they're fine or they're not that bad, the question then to ask is, well, can you get the dog's attention? Will it play with you? Will it take treats? Can it be distracted? Because if you can't, if it won't, if what all it's doing is trying to hide, or it's trembling, or it's buried behind the sofa shaking, that's pretty severe. And the animal needs help. Symptoms tend to fall into two main categories. Either their behavior is inhibited, or the stimulus causes behaviors to be expressed. So and examples of inhibition of behavior are things like crouching, hiding, whining, just kind of sitting there panting and salivating. Those are all signs of behavioral inhibition. Signs of arousal or overstimulation include things like bolting, running, trying to escape, pacing. They just can't settle at all. Attention-seeking behavior is super common. That's where the dog crawls up on the person's lap, or up in their face, or jumps at them, or paws at them all the time. That's a sign of attention-seeking behavior and is usually due to anxiety. They become hypervigilant, scanning, head like on a swivel. They may eliminate, urinate or defecate because they're so scared. Again, the salivating and drooling, vocalizations, whining, chuffing, and they may even become destructive or self-injurious, cause injury to themselves. And those are the ones, obviously, that, again, that we see because you can't ignore that behavior. I don't know if well, this is kind of early signs of stress, things to look for where the animal's being suppressed and just so worried. And I don't know if you can see it in this video or in this photo. I hope you can. This dog seemingly looks relatively quiet, like it's not doing much of anything, but can you see the pools of drool on either side of its mouth and reflective surface? It's crouched down, lying there, just drooling because it is so worried. These are actually patients of mine, both of them with storm phobias. They would jam themselves into this corner in the kitchen. The one predominantly brown greyhound with the white collar and head. Its head is facing into the corner and it's stress panting. The predominantly gray or white greyhound is curled up kind of in a fetal ball. And although you can't appreciate it in the still photo, she was shaking the entire time. It's the trying to escape group of animals that's most likely to be presented for help. And it's the attempts at escape that can lead to injury and destruction of property. So this is what people notice this. Often these animals may be presented for something like separation anxiety or a lack of crate training because the animal becomes frantic when it's crated. But careful evaluation of the history and the information that the client or the customer presents will indicate that it's cyclical. The behavior is cyclical and is associated with usually a noise event or storm event. In most of these situations, video is really, really necessary, helpful for sure, but often necessary to figure out exactly what's going on with these animals in terms of their behavior. I assume that most of you are familiar with the FAS scale. It can be pretty useful in figuring out exactly how severely affected an animal might be, but also in getting your customers or your clients to better pinpoint exactly what's going on with their respective animals. So there are now FAS scales available for dogs, cats, horses, and parrots, and can be really useful as an objective measure of stress. You should be able to get them for free from the Fear Free site, shelter site. This is just a little video. I thought it was worthwhile because it clearly indicates some of the signs of fear and anxiety that can be provoked by these storms and other noise events. So we talked about the panting. Also the cowering with the trembling and the shaking. Hiding, often they'll go under a bed or down in the basement behind furniture. They seem unable to settle. Just can't find a place where they're comfortable and where they can relax. The fetal position, cowering, hunkering down, constant lip licking, even though they're clearly not thirsty. Won't take their favorite treats. They're just too worried to eat anything. The head on the swivel that we talked about, that hypervigilance. And then the barking or whining at sounds. The wrinkled brow and the pinned ears, I'm sure you're all very familiar with that. And then the repetitive stress yawning, when clearly they're not tired or sleepy. And then the attention seeking we talked about. Freezing, just not moving at all. When really what we'd like to see is that loose body language and true indications of them being relaxed. So what's the prognosis on these dogs? Well, it varies greatly, and a lot depends on how badly affected they were when people finally seek help, try and get some solutions for this. The longer the problem's been going on, the harder it is to treat, right? Because the fears become more and more ingrained, and they have a history of learning that these experiences are terrifying for them. So it makes it really hard to counter all of that. A lot depends too on whether there is a single sound that you have to worry about, or are they worried about a lot of different sounds? Because the more sounds that they are concerned about, then the harder it is to control that, manage it, mitigate it. And the more likely they're going to be constantly bombarded. Interestingly enough, sound sensitivity, noise aversion, phobias goes hand in hand. It is a comorbid condition that is seen with great frequency in dogs that have separation anxiety. So about 40%, give or take, of dogs that have separation anxiety will have noise phobias, and about 40% of dogs that have noise phobias are going to have separation anxiety. So whenever we see separation anxiety, we always double check to see if they've got noise phobia. And whenever I've got a dog that has noise phobia, I always do a deep dive to try and figure out if maybe there might be separation anxiety going on as well. It also, because those two things go together, because they're comorbid, it's another strong argument for potential genetic basis for those conditions. Prognosis is going to be impacted by the effectiveness of the treatment used. I mean, by the time they're shaking and hiding and burrowing under the bed, you know, I'm really sorry, but like the comfort chew or whatever you're getting on Amazon ain't going to cut it. They need something that's going to help them with that stress and anxiety. And a lot also depends on whether or not the clients are willing to take any steps to help the dog. You know, are they willing to take make any management changes in order to help them, or are they going to leave them locked outside in the glass solarium when the storm runs through? Because that's not going to be helpful. And some people are more willing to implement changes in their living arrangements and or to do desensitization, counter conditioning than others. I've had many of them are willing to do management changes or environmental changes. Few of them are willing to do the work associated with behavior modification. So what are the barriers to treatment? I mean, why aren't more of, I mean, because we just said about 40% of dogs, 30 to 40% of them can have this issue. Why aren't they seeking help for these dogs? The clients that we're most likely to see, like I said, in our location, but also based on the various studies, are those that actually injure themselves during one of these events, and then the clients will seek help. But there are other barriers or other reasons why owners might not seek help. Part of it is obviously cost, right? There's cost involved with treatment, and so they figured that they can get by. But a lot of them don't think that the animals can be helped. They don't think that there are effective treatments out there, or that they're too difficult to implement, or some of them don't even know that there are any treatment options. And then, as we've talked about, a lot of people think that the dog's just not that bad. And they need to be educated and made more aware about signs of distress in cats and dogs and what that actually looks like. A cat that hides underneath the bed 23 hours out of 24 is not a happy animal, for example. So what's the treatment? Well, in terms of things that people can do in their home that aren't like super involved or super costly, we'll talk about each of these in more detail as we move through the talk, but basically creating a safe place for the animal. Pheromones are something that can be used that do seem to help alleviate anxiety and distress, and they are an over-the-counter option for folks. Things like wraps, things like massage. There are a few supplements out there that have some research to back them up, and I'll mention those to you. But if those don't work, then clients really need to be informed or educated about the fact that there is short and long-term medication available that can help these animals, and or if they're willing to put in the sweat equity, desensitization therapy actually can be quite helpful, and we'll talk about that a little bit more. So sanctuary or safe room, we only have to talk about setting up a spa room for the animals, but it very basic. It consists of a quiet place with some bedding, or in the case of a cat, something like a cat igloo or a box where they can go and hide. You want to turn on the lights if the problem is a thunderstorm, because it's the flashing that really worries the animals. Having the lights on helps minimize that contrast between dark and light. You want to close windows and curtains, again, to help muffle sound and to decrease the light contrast. A white noise machine can be helpful, or things like classical music or species-specific music, like through a dog's ear or through a cat's ear. The reason why we don't advocate for television is because, or even radio for that matter, is because as people are talking or presenting or shows going on, there's a normal ebb and flow or pause in conversation. And if the noise occurs during those pauses, then it can be stressful to the animals. Something that's more continuous in nature, you're less likely to have that ebb and flow, is going to be more effective. And then I mentioned pheromones. In the case of dogs, that would be adaptable. In the case of cats, it would be your fell-away. Those would all be helpful for them. Here's a little bit more information on pheromones. As I mentioned, there are studies that indicate that they can be helpful. These are actually studies directed at noise sensitivity in dogs. So you can see that there are 4 different studies that show reduced noise sensitivity with dogs that are exposed to pheromones. So super helpful. The purpose of a pheromone is that it acts as a chemical messenger that cues the animal, that letting them know that it's a safe place for them. So basically helping them be calm. Pheromones are usually available in diffuser sprays, in the case of dogs, and collars as well. So what is used just depends on the environment. If you're trying to set up a safe room, you could have the diffuser plugged in the safe room. That would be super helpful. But if it's a dog, for example, that likes to wander in different locations in the house, then maybe a collar would be more effective. So picking and choosing based on the environment that the dog lives in. Once the dog gets to the point where they're actually showing destructive behavior or escape behavior, pheromones just aren't going to be enough, as you can see from the results of that last study that I've listed. Ear colors are actually super effective. But again, you've got to train your dog to tolerate them. You can't just whip a set of these out and try and slap them on a dog's head and expect them to be happy with it. These are 3 different brands that are available out there. Interestingly enough, some of these were actually developed, the rec specs, for military dogs, for travel on military helicopters to help protect their hearing. But they work great for dogs that have storm phobias or fireworks phobias, assuming that people are willing to do the training that will allow the dog to become comfortable with them and tolerate it, right? So this is the aspect that I was telling you that I struggle with a little bit with our clients, that often they don't have the time or the wherewithal to do the behavior modification or desensitization, calm conditioning. Excuse me. RAPS, the results are mixed associated with RAPS. The mechanism of action is not really known. There's some speculation that's like a swaddling effect that kind of helps calm them and hold them secure. The papers, the research to date, no, not super helpful. The 2 that are out there are the Thunderstorms and the anti-static cape. But the fact of the matter is that it's not going to hurt the dog. So it's kind of a no harm, no foul treatment. Some of my clients feel that it helps. So why the heck not try it? They're not that expensive. So it might be worth a go. I will say, for some dogs that are noise sensitive, the sound of that Velcro, the sound when you open it or put it on, that noise alone scares them. So clearly that's not going to be helpful for those dogs. Massage. Some of you may be into the T-Touch, Linda Tellington-Jones, but honestly, just gentle rubbing, and it seems to help in general. Long, slow, steady strokes. Most dogs literally eat it up. They enjoy it. And you can cue it or link it with a word to help the dog begin to make the association to relax. So it depends on, pick a word. It could be settle, it could be chill, it could be relax, whatever you want to use. But the idea is to start to develop a conditioned response to that word associated with the massage, to get the dogs to be able to take a deep breath and relax in those situations. No particular studies to back this up. This is just information, word of mouth that's been shared. But there are a couple studies that are kind of interesting. And one of them you all may be familiar with, that shows that in a shelter setting, at least, dogs that are petted, human volunteers petting the dogs, had lower cortisol levels than dogs that didn't receive human contact and petting. So that would indicate that maybe the massaging and petting is really beneficial for some of these dogs. And we had the same kind of experience with dogs that were handled and petted by their owners prior to having blood drawn. They had lower cortisol levels. So maybe the petting and the massaging isn't such a far-fetched thing, and you can certainly try it, or have your clients or customers try it to see if it helps their pets relax. And we're back to that photo that I started our talk off with, and that is that we're trying to establish a conditioned response. And the way to do that is to reinforce calm, quiet behavior and encourage independence. So we don't want the dog up on top of us all the time, or the cat up on top of us all the time, because we can't be there all the time. We can't be there 24/7, and we can't be their permanent security blanket because we can't physically be with them all the time. And so we have to encourage them to be independent, and we have to get them to the point where they're able to relax on their own. So this is my guy. His name is Possum. What you're seeing is him on his mat. He has been trained to that mat. That behavior has been reinforced time and time again. And believe it or not, this photo is taken on our a trip to Maine. We just walked into our hotel room. He's never been in the hotel room before. I've taken the mat, thrown it down on the floor, and I've told him to go to his mat and settle. And that is a response that I've gotten. Head down, relaxed body language. And again, because this behavior has been reinforced over and over and over again, he is then able to practice it in other situations and other locations and other places. This behavior can be learned, it can be taught, it can be reinforced, and it can be super, super useful with dogs that are worried or scared. Because imagine if you could then take out his bed, or take out his blanket, or take out his mat when the storm comes through, or when construction work starts, and you send him to his mat, or you send him to his bed, and you reward him for that calm, quiet behavior, versus allowing them to pant and pace, work themselves up, become more and more aroused and more worried. So that's the kind of behavior that we're trying to develop. Supplements that are out there, the ones that are most commonly seen on the market are Zilkine, Angstane, Solaclin, and Composure, or Composure Pro. There is research to back up the use of Zilkine and Angstane. Zentrol is no longer on the market, unfortunately, and there's no research to back up the use of Composure or Composure Pro. They have the right ingredients, but it's at very, very low levels, and there's no indication about overall efficacy associated with them. So they are very expensive treats, though. Here's just a close-up of the paper on Angstane. It's relatively effective. You can see about 94% of the owners felt that they saw improvement in their dogs with Angstane, with mild storm sensitivity. So some of those over-the-counter ones are worth trying. But you want to make sure if you're going to spend money or encourage people to spend money, that you're going to use ones that have the research to back them up. So Zilkine, Angstine, and Soliquin. There's some diets out there that are supposed to help reduce anxiety. The ones that are most commonly referred to, or I think most people are aware of, are Royal Canin Calm and the Purina Pro Plan Calm and Balanced. The Royal Canin Calm, the one study or the two studies that have been performed on this diet did show a reduction in anxiety, but it was not specifically geared towards noise sensitivity. Nonetheless, for a smaller dog, it might be worth trying. Purina Pro Plan Calm, again, has the appropriate ingredients in it, but there's no specific research that indicates that it's effective. The short-term medications that are out there that your veterinarians and your vet behaviorists are going to use are going to be things like benzodiazepines, so basically like doggy Valium. Drugs like trazodone also provide some protection from noise, sensitivity, anxiety, and your alpha agonists like clonidine, your pain medication and anti-anxiety medication like gabapentin. And then newer on the market is a gel called Cilio. Cilio is pretty interesting. It actually blocks the release of norepinephrine, so the fight or flight hormone, and decreases the dog's response to stress. It's very fast acting because it's applied to the gum, so it kicks in within about 15 minutes versus the oral medications, which can take 1 to 2 hours to be effective. And because of its fast mechanism of action, it's just a little bit more convenient for people to use. You don't have to try and time the drugs. And we've seen really good results with it. Unfortunately, it's a prescription and patented drug, which means that the cost is high or higher compared to generic oral medications. If people are going to use these short-term medications, they really need to do test doses to make sure that the drugs actually work, that they don't cause any weird side effects that we would rather not have, and so that the client or owner is aware of how long it takes to kick in. Again, because it varies from individual to individual, and some of these drugs can take 1 to 2 hours to become effective. The technician that I work with, licensed veterinary technician I work with, she has a dog that she uses trazodone with, but it takes 2.5 hours for the drug to become effective. So think about the timing of that and how you would plan in order to make sure that it was on board before the event of concern. A lot of things can affect the efficacy of the drug if they didn't eat, if they did eat. And if you're using it, for example, for storms, that means that because you can't always tell whether these storms will actually truly come through or not, despite all those weather apps out there, that means that you have to give the drug 2.5 hours in advance, or 2 hours in advance, or 1 hour in advance, if there's a 30% or higher chance of that storm coming through. And that means that in some situations, your dog is going to be medicated when he doesn't need it. But remember, if the dog is not medicated and they're exposed, they're going to get worse over time. And that's why most of these animals get worse over time, because people either miss the window of the drug administration, or they don't want to, quote unquote, drug their dog all the time for no reason. And so they don't give the meds. And then the storm comes through, and then the dog is exposed, and the dog is going to get worse. So this may mean multiple doses of drugs given per day, and it may mean that in some situations, subsequent days, and it may mean in some situations that the dog didn't really need it, but he got medicated anyway. And then it's hard to plan. Like, how many people are home at 3 o'clock so that the drugs are on board for 5 o'clock storms? So that's where we run into issues. because of that, because the short-term drugs are so hard to predict and to do the timing on, most of these animals that have severe issues or concerning issues are put on some kind of long-term medication to decrease the overall level of anxiety. And that's going to be your selective serotonin reuptake inhibitors like fluoxetine, doggy Prozac, or your tricyclic antidepressants like clomiframine, which is Clomicalm. None of these drugs are approved for treatment of noise aversion. Our thought, though, is that by decreasing overall levels of anxiety, that we improve quality of life for these animals, which we're sure that we do. Everyone's going to ask about CPDT. It's the latest and greatest. Their problem with that is that the Food and Drug Administration has kind of thrown it up their hands in despair, and all the respective states have kind of come up with their own rules and recommendations. In Virginia, it is illegal for veterinarians to prescribe CBD. Just so that you know, we are not in the medical definition of practitioner. Human medical practitioners can prescribe CBD for their human patients. Veterinarians cannot legally do so. Because the Food and Drug Administration is not regulating it, it means that it's being sold as a supplement, and that means that there is no quality control associated with it. In other words, you're reliant on whoever's producing that CBD, that they are going to be good boys and girls, and that they are providing you with quality product. Nobody's checking them. Consequently, when they've tested batches of CBD, what they found is issues such as heavy metals, high levels of heavy metals in it, lead and mercury, high levels of pesticides, too much of a product, too little of a product, and then in some situations, high levels of THC, which is the hallucinogenic component of marijuana or hemp. Shouldn't be in hemp, but again, depends on the product. And dogs are very sensitive to THC, more so than people. So you have to, it's a buyer beware market, and you need to be very careful in using this. The one study that was done on anti-anxiety effects of CBD in dogs, they found no impact and for noise sensitivity or noise phobia. It's not to say that further research won't show that it's helpful, but at this point, we just don't have that data or information. Desensitization therapy, what does that involve? Well, basically you use audio sound like CDs or YouTube videos or MP3 files, MP4 files to gradually expose the animal to whatever the sound is that is worrying them. You do it at a low enough level where the animal doesn't respond at first, and you can do fun things with them or give them treats when it's being played, so the animal starts to form a positive association with that sound, and then gradually increase the volume over time. It's a process. It takes at least 6 weeks to show an effect, but numerous studies have indicated that it does indeed work. If you're going to try desensitization counter conditioning, you want to do it during a period of time when you don't have to worry about some random event exposing the dog. So if you're going to desensitize and counter condition to thunderstorms, don't do it in the middle of thunderstorm season. Wait until winter when you don't have to worry about pop-ups and storms happening. Or if you're going to desensitize to gunshots, don't do it during hunting season. Wait, until the spring during birthing season when they're not shooting off guns, and you can do it. You can do it then. So it works. It does work. We know it works. There are multiple studies that show that it works, but most people are not willing to put in the time and effort to do that gradual desensitization and counter conditioning. And here's the icing on the cake. Note the bolds down at the bottom. Some dogs just don't respond to the recordings. And we can only assume that their hearing is good enough to differentiate between our crappy recordings and the real thing. So you do have to play around with the different formats and the different quality recordings, different modalities. I'm not suggesting that people go out and buy surround sound just to do desensitization and counter conditioning, but you may have to fiddle around a little bit to make sure that you find an appropriate audio recording that the dog will in fact respond to. There's a great website out of the UK that has these audio files available and a desensitization counter conditioning program that you can follow. Basically, it's all mapped out. So worth tracking down if you have an interest in this. Additional advice for how to deal with these animals. Well, as best you're able, ignore them. If they do the attention-seeking type of behavior, try and distract them. There's something else that they like to do, play Frisbee, a long-lasting chew or treat, belly rubs, whatever you can get them to do that to get them thinking about something else. And then we only have to jokingly talk about having, for example, storm parties, hence all the dogs in hats. So remember, we talked about owners' behavior potentially being a cue for these situations where they get worried, the dog's anxious, the owner's anxious, and then it just kind of ends up being this big mess. If instead, when there's a storm and a thundercrack goes overhead and the client instead, or the owner, customer says, party, and throws a couple treats or roughhouses with the dog, and the storm crack goes off again and they do the same, then that's going to be a whole different response from the dog and from the owner than the, oh my gosh, it's a noise, oh my gosh, what we're going to do, oh my gosh, this is a problem. So we talk about doing storm parties, or I have a neighbor who likes to periodically shoot off guns. So we have a gun party and the toys come out and we play. And basically to try and change the emotional response that the animal has in that situation. Prevention, adaptive collar on every puppy. There's a study by Sagi Denenberg that indicated that pheromone exposure with the puppies as they go through socialization and puppy classes seems to have some kind of a protective effect in terms of decreasing the likelihood of developing behavior problems when the animals get older. So that seems like pretty cheap insurance. Effective socialization, or if it's an older animal, desensitization, counter conditioning, where they have gradual exposure or pleasant experiences to a bunch of different sights, sounds, places. And remember, it has to be pleasant from the standpoint of the recipient, meaning the animal. And then lots of positive reinforcement in order to change that emotional response. So I have the Border Collie herding breed, genetic predisposition to noise, sounds, or phobias. Whenever there's a boom or a loud sound, or the neighbor shoots off a gun, he gets a treat every single time. So the bugger, the last time we were out in the woods, an owl hooted. It was up in the tree close by and it hooted. And the dog looks up at the owl and he looks at me and he comes trotting over, loose body language, tail wagging for a treat because of the loud noise. And I would happily go with that than having the opposite, which is the freak out, bolt and run kind of thing. So desensitization, counter conditioning, positive reinforcement, classical conditioning, where you link that emotional response to good things, they do work, they are effective. Remember we mentioned that there's every indication that early exposure may help prevent this. So I can also continue the story on myself. My husband at one point or another said that I was going to die from a lightning strike because when the Border Collie was younger, as a puppy, storms would come around and I would take him outside to play soccer. He loves a soccer ball. He thinks that's the greatest thing ever. So we would be out there in the pouring rain with lightning crashing down around us, playing soccer. And in the rain, because by God, my dog is not going to have a noise phobia or noise sensitivity. Hence the picture of the border collie puppy with a soccer ball. And then don't get a herding dog. Again, there's that genetic predisposition. If you want to prevent from having this problem, then don't get a herding dog. And then here's our case example. Not a herding dog, another greyhound, another one of the hounds, right? Crow came to me as a 7-year-old retired racing greyhound with a history of noise phobia from the time he was adopted. So again, that coming from the shelter or rescue, who knows what his background was. The owner had been managing him with melatonin, and then that wasn't enough, so she tried trazodone, so a short-acting medication. Remember the problems or the challenges that I mentioned to you about trying to time that, making sure that it was on board every time, a storm comes through. It's really hard to do. And since their adoption, he's always been afraid of loud noises, but then summer storms came through. They were pretty severe, and his anxiety got worse. In fact, it was so bad that he developed exertional rhabdomyolysis. And for those of you who are not veterinarians in the group, that's from extreme muscular effort. And that's because he was crouched and trembling basically for 7 hours and overworked his muscles and had to be treated in the ER setting to take care of it. That's how bad his fear and anxiety were. So let's see if we can play this. Give you an idea. So that's what he would do. He would freeze, he would shake, and then he would just pant the whole time. Wouldn't move, frozen solid. So pretty severe. So diagnosed with thunderstorm phobia. He also had fireworks phobia. So he was started on a maintenance medication. The owner had been trying the as-needed medication, and the dog was getting worse. So we put him on a maintenance medication to lower his baseline anxiety. We added in a benzodiazepine, so basically a doggy version of Valium, that was given twice daily, and he had a third dose as needed. And he did very well, except that a group bought the neighboring property and set up a gun club. You can't make this stuff up. Next door to the neighbor, to the owners of this dog. So now they've got guns as well. And they tried all these things to try and correct the problem. They did desensitization and counter conditioning, but they couldn't find a level at which to play the audio tape to begin desensitization, counter conditioning. Melatonin worked initially, but then became ineffective. They tried the over-the-counter stuff like Composure Pro and all those, the Thunder Shirt, the pheromones, didn't work. Trazodone initially worked, but then didn't. Tried various combinations, didn't work. And the combination that we tried, the fluoxetine and clonazepam, seemed to work most of the time, but he still had panic responses. So we increased his fluoxetine. That didn't work, so we switched him to a different SSRI with twice-a-day administration, still getting his dog equivalent of Valium, but we added in Cilio. So remember, that's the fast-acting one that I mentioned to you, that you apply to the gum line, and it takes effect within 15 minutes. And the dog did really well on that medication. The thing I wanted to point out to you is that what he started doing, and this is kind of jaw-dropping, is he would go, started going up to the cabinet where the Cilio was located whenever a storm started to roll through to request administration of the medication. And he would go to his resting place immediately after having been given the medication even though we know it takes 15, 20 minutes to kick in. So before it had even taken effect, he would go to his safe place and settle, knowing that he was going to feel better, which is pretty jaw-dropping. So you can't help them. They can be treated, but some of them, the severe ones, are going to need medication to help them. There's some great resources that are free, including this noise aversion fireworks handout located at today's veterinary practice. This is what it looks like. Kind of a cheat sheet on what we just talked about. Easy to hand out if you need something for your customers. There are a bunch of resources on the Shelter Fear Free website, and y'all should have access to them without any issues or problems. They have both dog and cat resources here. I wanted to share this picture of my veterinary technician in Crow, showing that he is and can be a very happy boy when he's appropriately treated. And just so that you are aware, I'm sure you're aware, I mean, this is not a problem unique to just us. This is an advertisement from the UK. This is one from Petaluma in California. This is one actually from Cape Town, South Africa. So storm phobias, noise phobias, fireworks phobia, very, very common. This one also from Canada. And some, God bless the Canadians, I'll tell you, they're ahead of us in a lot of ways. This is actually a news article from Banff, Canada, which is on the edge of the national park there. And they banned explosive fireworks, both for the safety of wildlife and the safety of their pets in the town. If only we would all follow suit, right? There are a number of other resources out there in behavior that I think would probably be worthwhile. The two books that I would recommend, if you haven't already read them, would be Decoding Your Dog and Decoding Your Cat, both edited and written by the American College of Veterinary Behaviorists. They've got good practical information in there for the respective species. And then if you are interested in cooperative care at all, this book would be useful. It's one that I helped to edit with Pat Miller, who has Peaceful Paws up in Fairplay, Maryland. And then these are just more pictures of my various herding breeds. Yeah, that's all I've ever owned. And with that, I'm happy to answer any questions if anyone's got anything that is pressing or that they would like to know more about.
I had muted everyone, so hopefully they're able to unmute and ask questions. If not, they can send us something in the chat.
Yeah, I don't see anything in the chat, at least not right now. Oh, Tina asked about lavender. That's a great question, Tina. Yes, actually, lavender has gotten some pretty decent research in a number of different species that indicates that it might have a calming effect. And so I think, again, that's kind of one of those no harm, no foul ones that would be worth a try. Just be aware that essential oils can be quite toxic to dogs and cats. So you want to not apply it directly to the animal in a place where they can lick it. In dogs, a lot of times a bandana works really well. You can apply it to the bandana and then tie it around their neck. That might be a good option in that situation. But yeah, it can help decrease anxiety, so worth a try.
I had a rough Rottie shepherd that was terrified of thunderstorms, gunshots,
Yep.
fireworks. He was 125 pounds and I had to sit and hold his hand or he'd be in my lap. I mean, it was awful. I will say that CBD oil worked wonders for him.
Yep.
Yeah.
Yep. Yeah, no, and I mean, that's part of the issue, right? I mean, it's great that he gets comfort from you, but then you have to stress or worry about what's going to happen to him when you can't be there with him,
Yeah.
right? To give him comfort. So hence the encouraging the independent behavior and trying to reinforce and develop that relaxation response so that they can do it on their own.
Yeah. He passed
Steph-
away, so I don't
yeah.
have him any longer, and my other dog, she's bulletproof. Nothing phases her. So
Yeah, that's a nice change. Stephanie asked if there will be slides or recording to be shared, and I understand from Diana that this has been recorded and will be posted on the your YouTube channel. Yeah,
correct.
well, it looks like that's it for the chat box. If there are no other questions, then I guess we'll say goodbye.
Thank you so much for taking the time. I really appreciate it.
You're very welcome. My pleasure for sure. Thanks for spending the afternoon with me.
Oh, thank you.
Goodbye.
Bye.